education, training is not enough. Experience matters enormously. For us, in the world of spiritual care, practicing your craft matters. And so does exercising. Because when I was a hospital chaplain, I worked in the medical ICU. That doesn't mean I was going to be very good in the Alzheimer's unit or in the pediatric unit. I spent all my time only in the medical ICU. So expertise is specific as well. Just because you're a great chaplain doesn't mean you're a great youth chaplain, right? So chaplaincy in disasters or crises is an expertise, and it does have to be practiced, and it has to be exercised, because often our experience is limited to what is frequent. The most frequent disaster is probably what? What do you think? Floods. Fires, right? Small things, not 9/11, Katrina, Ebola, scary, giant, big things. So if your experience is primarily floods or winter-related events, how ready are you for the school shooting at Syracuse, right, at the university, where, I don't know, 30 kids are shot in a dorm or a classroom building? Is that your expertise? No, definitely not, right? So experience matters also because you can get deployed for disaster work. It's easy to get deployed. You're going to hear more about that later. So exercise matters to make sure you have at least walked through some of these other scenarios, and knowing how to refer. One of the biggest tragedies, I think, of the Pulse nightclub shooting in Orlando was a lot of chaplains showed up and they had no experience working in the Hispanic community and no experience working in the LGBT community. So, fine, you've worked 1,000 floods and tornadoes in the Midwest. What do you know about a terrorist attack, the reaction to terrorism? What do you know about the Hispanic community? Because most of the people killed in that nightclub were Hispanic. And what do you know about working in the LGBT community? What do you know about working with someone who has been rejected by their family, that their family is just their community? What's it like to be gay? What's it like to be gay and the victim of a hate crime that doubles down as terrorism? So context matters too in that process. But the referral matters because any of us could end up responding. The question is, do we have enough self-control, a lack of a need to be the savior of the day, and can we simply say, I hear you, I've heard your experience, and I'm not the right caregiver for you, but I'm going to find that person. I'm going to find my colleague who speaks Spanish better than I do. I'm going to find my colleague who is LGBT or understands that community better than I do. Can we make that referral? And can we do it with humility and competency? And can that referral also be to mental health or medical care if that is the signs or symptoms, those are the signs or symptoms presenting themselves? Because the other challenge, of course, is if your mindset is, it's interesting that you say you're schizophrenic, but I'm pretty sure I can fix that with prayer. Pass, okay? Pass. You might not get credentialed in my agency, but somebody's going to throw a badge on you that calls you a chaplain. And the question is, are you an effective chaplain if your reaction to someone self-reporting a clinical mental health diagnosis is prayer is going to fix that? You're not the right person for this world. I don't mean the world globally, just the world of disaster response, right? So how do we make sure that that can be done appropriately, quickly, effectively? And self-care.